of the political fallout from the leaked documents last week further eroding public trust in authorities. Now we have frontline workers becoming anonymous whistleblowers of information that we, as journalists, have spent months asking for. If Minister Dix could just address how you hope to restore that public trust in what you're telling us at these briefings is what we need to know.
Well, I mean, I know you want to hear from him, but I can't tell you that this is surveillance data. We have from the very beginning shared that with a wide variety of our team members. There's over 100 people that are on our listserv for that information, and then it gets loaded up onto the BC CDC website. So all of that so-called leaked information is information that we've been sharing that's publicly available and more. You know, the VOC report is on the BC CDC website. Our adverse events following immunization report is on the BC CDC website. What is new, and what I've said today we are going to post publicly, is replacing the LHA maps with the heat maps now that include, for most areas, community health service areas. As we've had more cases in the last month, 6 weeks, we now can go down to a smaller geographic area, and those maps will be posted on Wednesday. They were approved by me to be posted about a week and a half ago. We were trying to get the process so that we could have them more interactive, but that has not been able to be pulled together quite yet. So we'll be posting the static maps, and then as we develop the interactive system, we'll post that as well. So that information is there for people, and we have been trying to get it out as widely as we possibly can. So I want to reassure people the first and primary role of the surveillance data that we collect is to make the best decisions from public health that we can, and that means sharing it widely with public health professionals, with researchers, with scientists, so that we best understand it. That's the primary purpose of the data, and that's how we use it at a local level, on a one-to-one level with public health, and at a provincial level to make provincial decisions about our program. And then we post as much as possible publicly so that everybody can see the data as well.
Thanks, Marcella. I mean, what we've done in British Columbia, I think people can count on this, is having our public health professionals lead the public health part of the campaign and providing full, constant, and full-throated support from the government for that effort. And that continues to happen. The leadership of Dr. Henry, of Dr. Gustafson, of all of our teams. With respect to the document from last week, you'll know that almost, I think there were 4 pages of the document that had information that wasn't public last week, and that will now be provided publicly. Those maps in question will be provided publicly. And over time, we provided more and more information. The regular and daily briefings on case counts, the presentation of information daily by the BC CDC, weekly, the surveillance data by the BC CDC, and we've consistently listened and provided more information when it's required. You'll recall, Marcella, one of our discussions some months ago was information about outbreaks in long-term care. That information continues to be provided every Thursday. It's no longer of as great an interest. Equally, information on PPE, on the surgical renewal plan and others has been provided in detail. That's what we've been doing from the beginning. But I think what people have confidence in and what's worked in BC, and it's a difference from other jurisdictions, is the strong support of the Premier for public health in what is a pandemic that's unprecedented in our time. And I would say that here in British Columbia, our mortality rate less than half of the national average. In other words, less than half of the average of the country, the average provincial rate in the country. The lowest mortality rates of any North American jurisdiction above 5 million people are jurisdictions in our category. It's pretty. It's been a significant effort, and I would say that effort reflects, I think, the response of regular British Columbians to the consistent and thoughtful and generous message of Dr. Henry and her team And I think that's going to continue to be the case. And I know that there are challenges from time to time, and we learn from those challenges, and we just keep going forward. And you've seen us adapt consistently through this pandemic, and we're going to continue to adapt in this phase of it as well. But what I want to say, and what's really important, what I've been communicated personally for months, is that COVID-19 is a vicious virus that we have to take care for ourselves, for the ones that we love, for the people in our neighborhoods, and for the people we don't know. And that means the guidance provided by public health and the orders provided by public health need to be followed, especially now, and that we really need people to get vaccinated. You see the changes today, how vaccination is opening up to more and more people, but you need to register to get vaccinated. And I really encourage people to do that. And I think the response on the ground to the call by the Premier to register, call by Dr. Henry to register, the call by leaders from all political parties to register, the call from community leaders. 390,000 people registered last week, and more to come this week, is an indication of where the public's at. They want to get vaccinated, and in their vast majority, they're following public health guidance and orders.